Well, I think there's mounting evidence that too many people get readmitted to the hospital after an admission for a particular reason. Focus has been on heart failure, but you can pick a number of diagnoses. And as many as 30% of those folks end up coming back to the hospital within 30 days or so. If we look further, some of the recent studies have shown those people that turn out not to have had a follow-up appointment with anybody in the office. They turn out not to have had their medications prescribed or prescriptions filled, often because they don't understand what their medications need to be. So I think then they end up coming back, which is a failure, really, of our first treatment episode. So if the goal is to keep people healthy, obviously the hospital is not the best place to be. I mean, that's not the cheapest place for them to be. And it doesn't necessarily reflect that they're so sick that they have to come back. It reflects the fact that we've gotten them better, but we haven't helped them stay better. So as care has become more fragmented, again, we know that the average Medicare patient in a year sees 2 primary care physicians and up to 10 or 12 specialists. As their care becomes more fragmented and more complicated, we have people who are sick, often frail, often elderly, who have really complicated medical situations, and then we sort of tune them up and send them on their way without providing some really basic things like clear instructions about their prescriptions and like follow-up, so that they can follow the recommendations that we've sort of arranged for them. So if we can do a better job helping them actively engage in the treatment plans that we work so hard to make for them, then they're more likely to be successful, stay out of the hospital, better quality of life for them, less expense for the medical system. Virtually every certainly of the acute ministries is working on strategies regarding medication reconciliation. That's one piece. If we can give people clear instructions at the time of discharge as to what they should be doing with their medications, that will be one big help. I don't know that that's being done specifically to prevent readmissions, but I think it will help to reduce readmissions. And then I also think that there are some more evolving strategies to look at what are preventable readmissions, what are the factors that lead to those readmissions, and then devise some strategies to deal with them.